Okay, I think there are enough people for us to begin. I would like to introduce you to our speaker, Ms. Priya Kuberan, who is a physiotherapist who works in Bangalore, and she's been practicing for quite a lot of years now. And chose this topic because she also is an animal enthusiast and has a lot of pets at home as well. And I would probably just say that there is nothing much more to say rather than what Priya has to introduce us to. And I hope you all have a good learning session and understand how animals can enhance your child's communication and other areas. So all the best, Priya, and happy listening to everyone. Thank you.
Thank you so much, Archana. And thank you everyone for joining me. I think with the COVID lockdown, all of us have free Saturdays now. So our team has been able to capitalize on filling your evenings with some nice information sessions. Today's topic is role of animals in a child's journey. It's a topic that's very close to my heart. And I will walk you through what I have found in terms of research and also in terms of intervention. You can probably hear my cat in the background, so do not mind that. I'll just share my screen and we can begin. Yeah, you can see it, Archana?
Yes, I can see it. Go ahead.
Okay. So just to explain the topic a little bit before I start with the slides, what the topic actually is intended to do is to introduce parents and therapists and whoever is my audience today in terms of practitioners or parents of children with disabilities, children with difficulties, or children who are absolutely normal in terms of their development, is that animals, when introduced correctly and in the right way at the right age, can bring about a lot of positive changes in your child's life. So, but there is also a lot of scientific evidence for that. There are studies conducted routinely in all over the world. And today's topic is going to be a very evidence-based overview, where I'm not just saying things that people say all the time. They are not going to be biased views. They're going to be backed by evidences, and anything that applies to neurotypical, that is children who are growing up normally, and neurodiverse is basically children who have mild to moderate to severe difficulties. Whatever works for one group can also work for the other group. So I would urge you to pay attention and learn as I progress through the slides. Animals for me have been a very integral part of my life for the last 1 decade, perhaps. I never grew up with animals, but they have made a very transformational change. And I was lucky enough to attend a workshop last year that worked with animal assisted interventions. And it has opened up my world to understand that there are so many fields of rehabilitation that we don't even know about. So let's just begin with the talk. So before we progress on to understanding how animals actually play a part in your role, you have to understand why is it that humans have such an innate bond with animals. So that is explained by this hypothesis called Biophilia Hypothesis. Bio meaning living, philia meaning love. So that basically means love for the living. So it's been proven that humans have a very natural tendency, it's an inborn tendency to seek connections with the nature and other forms of life. So it's not just animals, we also have a lot of connection towards greenery, we have a lot of connection towards water bodies and mountains. So it's a very innate ability, and it's because we are always trying to understand how we are connected to them. And this particular hypothesis was studied in detail by Mr. Edward O. Wilson, who was a scientist, and he published his work in this Pulitzer Prize winning book called Biophilia. This book is a treasure trove of understanding how humans are such an integral part of the world that we live in, and we are a part of nature, and how we should learn to understand that we balance each other in terms of what roles we play in the nature. So Edward O. Wilson started studying about how humans find themselves in nature and how they play different roles, and started going back to probably the early humans. So our attachment to animals comes from the fact that early humans, when we were hunters and gatherers back before the Stone Age era, is that human survival was dependent on the various signals that the animals gave them from the surrounding. So, for instance, humans used to observe the herbivorous animals, and they would understand what fruits and vegetables, sorry, back then fruits and vegetables weren't there, but plants, and what shrubs and what weeds can be eaten or not eaten. If the animals are edgy, the early humans would know that there is danger around. And at the same time, when the animals were relaxed and resting and at peace, the early humans were reassured that there is no danger nearby, and even they can relax and they can be in a very good state of mind. So, if you notice, a lot of this early human tendencies that we had, we even retain now. So, whatever animals the early humans feared, we fear them even today. And similarly, the animals that the early humans were okay with, we seem to have a good tolerance with them. So, biophilia hypothesis actually tries to understand how humans across generations have slowly adapted themselves to this constantly changing world, but at the same time, we retain a lot of our instinctive reactions to animals. Uh, in particular, why animals and humans? See, first of all, we all know that humans are social creatures. We have always lived in tribes, we have always lived in groups, we have always lived in packs. And with being a social creature, there comes certain social responsibilities. We look out for each other, we share things, we talk to each other. And animals, actually, they are highly responsive. Like if you're around an animal, you can always elicit responses. You can make them happy, you can scare them, you can make them talk to you, you can make them come to you, you can shoo them away. But basically, what are you trying to do? You are doing something to elicit a response from the animal, which is a deficit that we don't get from plants. So say if there is a weed growing in your garden that's not suitable to the other plants, we don't even think twice before we pluck it out or we uproot it. That's because although plants are such an essential part of our nature, they don't respond back to us. So we don't, although we say accept them, we embrace them, we are not necessarily drawn to them the way we are drawn to animals. And that's purely because animals respond back, they interact back with you. And this particular interaction gives, it's very gratifying. It instantly satisfies that social urge in you. And of course, domestication was something that happened as humans started settling. So domestication, we started domesticating some animals as companions. So we have dogs and cats. We started domesticating some animals for food. So you have goats and cattle and turkey and reindeer. And then you also started domesticating animals for non-food, basically as a vehicle, or as a transport mechanism, or as animals that carry your burden, or animals that you use for warfare. So you have horses, donkeys, camels, and elephants. Just to give you a small differentiation between two very important terminologies in our interaction with animals. One is domestication. See, domestication has happened over generations. So now, all the animals that we have domesticated, they are genetically modified to accommodate humans in their lives. Some animals are a part of our food chain. So generations after generations, they have just been bred for food, and so they are subservient to us in a way that they don't feel comfortable enough to interact with us. But some animals whom we have reared them as companions, like cats and dogs, they are not a part of our food chain, at least not in the majority of the world. So these animals are always they are okay with us, they are comfortable sharing things with us, they are comfortable sharing interactions with us. So domestication is one of the major things that happened that changed the way humans interacted with animals. And taming is, of course, another word that I thought was very interesting, is that it's the way humans actually bring the wild into our lives. We probably have a wild cat in the neighborhood, or we have a wild dog in the neighborhood, or we live in the edge of a forest and there is a wild leopard whom you've been feeding. But it's a very individualistic process. You can tame a wild animal, but it's not a generalized process. So it's just an interesting theory that we have interacted with the animals in two different ways. We have either domesticated them or we have tamed them. Now, just to go into a little bit of history, why was there a need for domestications? In the early human age, the earth was cooler. There was an ice age going on. There was a glacial age going on. So, because the climate was not at all favorable, human beings used to travel across everywhere. So their populations were controlled, and they were from the hunter-gatherer community. But around 11,000 to 12,000 years ago, the temperature in the world started becoming warmer, and the climate became very favorable. And slowly, human beings started settling, and then their population started increasing. And they realized hunting and gathering is no longer sustainable. You can't just live on food that you hunt and gather. And that is when the whole idea of domestication started in the world. And when you started settling down, agricultural societies emerged. So then you have, if you see step by step, we started domesticating various categories of animals, like the goats, the sheep, the cattle. They were domesticated around 10,000 years ago. Pigs were domesticated around 8,000 years ago. Horses were domesticated around 5,500 years ago in Central Asia. Poultry, that is chicken, came much later, around 4,000 years ago. Cats were also domesticated around the same time. And now, amongst all of this, domestication of dogs has been the oldest, and there are differing theories on when it happened. Some studies talk about the fact that the domestication happened almost 30,000 years ago, and some other studies talk about say 10,000 years ago. So dogs have been the oldest domesticated animal in a human life. This is just a small, I think, a chart explaining the timeline. And if you can notice, dogs here are domesticated like so many years back, and there is a very good range. And after that, slowly we started other animals. You can see the mountain goat, the reindeer, you can see the bull, you can see the yak, there's the pig here, you can see the cat, you have the horses, camels, donkeys, and then the bulls. And then smaller animals have been domesticated recently for various purposes. So you have the ferret, you have the rabbit here, there's a mouse, there's a rodent. And of course, foxes apparently are very good pets of late. So this is just a timeline for you to understand how slowly we started domesticating various species of animals. Now, just a small psychological background. Attachment theory is basically what defines the maternal bond that a mother shares with a child. And it's been found that our attachment with our animals is also very similar to this particular attachment theory, because attachment theory talks about how we exchange care, comfort, and interactive pleasure with our child. In the same way, when an animal enters our life and it shares our life, we start caring for the animal, we start comforting the animal, we start interacting with the animal for both the animal's pleasure as well as ours. So attachment theory, although started from the maternal bond, it was also extrapolated into the human and animal bond. And of course, the social support theory. Humans have, since we are social animals and we enjoy all the aspects of being a social animal, we do all the social activities with our animals too. We talk to them, we love their company, we touch them, we comfort them, we care for them, we nurture them, we laugh at them, we pay a lot of attention to them. So that the social support theory also supports the fact that we are very attached to our animals. And of course, true bond, and this is in particular with these particular animals, that's the dogs, the cats, and the horses. Whatever bond we feel from the animal also feels back from us. And this true bond actually solidifies the way we are sharing our lives with these animals. Now, that was a psychological basis. Just talking a little bit of neurophysiology, and if it's too complicated, we can probably discuss it later also. I will just walk you through a few major points. Just for a minute, if you spend time looking at these three pictures here, you have a baby, you have a puppy, and then you have a kitten. Now, if you notice, what they have tried to do in the pictures is try to highlight the roundness of the baby's face, the roundness of the puppy's face, the roundness of the cat's face, and the peculiar eyes, the fact that there are not many expressions. But what you're thinking in your mind as soon as you look at these pictures is, wow, it's so cute. And the scientific word for this cuteness that we see is called as baby schema. Baby schema is basically an emotional response that all humans share when we look at a baby's photo or a baby's image, basically. And when we look at a puppy or we look at a cat or many mammal offsprings, when we see the baby mammals, uh, the baby schema gets activated in our brains, and we are overcome with a very strong emotional response. So baby schema is one of the neurophysiological bases of our bond with the animals. And of course, oxytocin. Oxytocin is called as the hormone of love. It is the hormone that generally is released when we are feeling good about ourselves, when somebody else is making us feel good about ourselves. It is the hormone that is released when we hug each other, or when we are holding each other's hands. And the same oxytocin releases when we start interacting with our animals. So oxytocin basically starts making you feel good. It enhances your feeling of well-being, and it sets a very good foundation for healing and a lot of good things that we are looking forward to. Limbic system, a little technical, but limbic system is the brain, the part in the brain that is responsible for your emotional responses. It is the one that understands fear, it understands pleasure, it understands disappointment. And it's been proven that a lot of higher mammals, including the dogs and the cats and the horses, they share a very similar limbic system to humans. So that means all of these animals are also guided by their emotions. And so that's one of the reasons we are attached to them, or we connect with them, because emotionally we are able to connect to each other. And of course, the most important element here is sentience. Now, sentience is basically an animal's ability to perceive and feel things in their environment. And I think of late, because there is a lot of emphasis on animal cruelty and all that, a lot of conversations are happening in the world about sentience. And the next slide, I'm just going to give you a few examples of sentience in various animals. Like for instance, if you see the first picture, sheep are apparently able to pick up the faces of their friends. So if you see in this picture, this particular sheep was made to enter the room and shown pictures of two humans and two sheep. And every time that the sheep entered the room again, he was able to go and identify the picture of a sheep, although it is two-dimensional. And no matter how they changed the order, the sheep was always able to do that. And of course, we know that elephants, they form such strong family groups, and they have strong memories, and they pass along information from one generation to the other. And that's a very strong, complex way of living. And for us to imagine that an animal that we usually consider an inferior is able to process and do such complex association activities, it sort of reinforces the fact that every animal is sentient. Of course, capuchin monkeys, there were experiments done where the monkeys actually showed outrage when they were receiving unequal pay for an activity. So apparently one monkey was given one biscuit for an activity, and the second monkey was given the second, and they could sense that the monkey that received less was a little upset. And apparently chimpanzees share food if they think that it can keep their group peaceful. And this was an experiment that I think all of you should probably go back and look up. It was when um, this particular rat that was outside the bottle, he actually gave up on a food treat that they were offering him in order to give company to his rat, and who was in trouble. And of course, octopuses, we already know that they are very intelligent, but octopuses are able to understand whether a food is really worth the effort. So if it's a food that they don't like, they will not make any effort to go and take it. So the fact that animals demonstrate such unique abilities sort of makes us understand that we share a lot in common with them. Before we progress, I just wanted you to sort of share this video with me. I'll be walking, so I'll be sort of fast forwarding little so that we just focus on the fun elements. Don't mind the advertisement. Sorry. So here we have a nice video of a baby interacting with a dog. And then a few seconds later, they have shown a baby sleeping in very close proximity with a full-grown cat. And they are sharing a very peaceful embrace. And then we have this baby playing with the cat, and the cat cooperating and not getting panicked. And then here we have a puppy playing with the bubbles, and the child is nearby in proximity. And of course, looks like a newborn baby, and the cat is being allowed to interact with it. And here you have a cat that's in close interaction with the baby and indulging in a little rough but gentle play. Here you see a dog licking something from the baby's hands. Here you see a cat like fist fighting with the baby. Yeah, so internet is full of such videos. You know, you just have to Google cats and babies, or you have to Google dogs and babies, and you will find thousands of videos, thousands of pictures showing you adorable interactions between the two of them. But they all are anecdotal evidences. And when I say anecdotal evidences, I mean it will be an individual experience. Like I have many cats in my house, and I adore them. They are very good to me, and I know that I gain a lot of peace from interacting with them. But just based on my responses, I cannot say that, okay, you should also get a cat, or maybe somebody else should get a cat. So just to prove my point, I have another video that I want all of you to see. There'll be another, sorry for the, yeah. So you saw another picture of the same kind of video. Of course, it is meant to make us laugh, and it's supposed to be funny. But if you notice, each animal, when there was an unexpected stimulus, ended up doing an unintended harm to the baby. Either the baby had a fall or was scratched. Or I'm not trying to say that it's not something that you should not allow, but it's more like all of these things that we see on the internet or that you hear from people, they're all anecdotal evidences. So the problem with anecdotal evidences is that, first of all, they're very individualistic. Like I said before, just because I love cats and they are very nice to me doesn't mean that they should have the same effect on you. And they are very biased. So if there is a dog in a household, they will always speak good things about the dog. If there's a cat in a household, so there's a lot of bias to these evidences. And they are very contextual also. Like if you are in a house where the dog or the animal, they are offered all forms of luxury, and they are well taken care of, so the dogs will be peaceful, quiet. But then if the same dog is put in a different environment, the same dog might not behave the same way. So it's very contextual. And also, it cannot be generalized based on the first group of videos that we saw. I can't go and say, yes, maybe you should get a dog for your child. I can't prescribe a dog based on the fact that there are adorable videos about them happening on the internet. And that is where the need for putting together this study that I tried to do, where I tried to put together evidence on all the research that has happened in terms of human animal interactions, human baby interactions, human children interactions, because it helps us, first of all, to identify a good child animal fit, to understand which animal will be well suited for you to introduce to your child if you are trying to look for a pet, or if there are any other forms of animal interactions that you're looking for. And also they help us in looking for specific outcome measures. Like when we go ahead and look at other studies, there are many studies done understanding a particular animal's effect on the child's reading abilities, talking abilities, movements, socialization. So based on what your child needs, you can probably pick up an animal, or adopt an animal that will really work for the child. So that is why it is important to also understand all the research that's happening in incorporating animal in a child's life. Now, of course, animal assisted interventions have been happening since the ancient times. Apparently, the ancient Greeks always allowed animals to interact with their wounded soldiers. And based on a lot of history, physicians in the 1600s started incorporating animals in recovery procedures. In medieval Belgium, apparently the wounded animals and the wounded soldiers, they were rehabilitated together, and they noted that the recovery process was faster. Of course, in 1800s, Florence Nightingale, we all know her as a mother of nursing. She tried to study the effect of small animals on anxiety and stress in young adults who visited her care facility. A lot of American Red Cross workers started rehabilitating the World War soldiers with farm animals in centers that were built in farms, and they noticed that the recovery was faster, and the post-traumatic stress was very less in these soldiers. Now, of course, we do have a lot of evidence in history, but Boris Levinson was the first person to actually document animal assisted intervention when he started conducting psychotherapy sessions with his dog. And he published his work in 1960s, which was further corroborated by Sigmund Freud. Anything Freud did in psychology is looked up to. And even he published a lot of matter with the fact that he used to conduct sessions with his pup in the room, and he would notice that the outcomes are far better. We are going to move towards pediatric care, but before we go there, animals in healthcare was always introduced for adults first, because it was known that we can handle this better. So in what all formats were adults introduced to animals? Animals were introduced in psychotherapy for adults, in many pain management clinics and pain management procedures. It was noted that if animals are in the facility with the patients, their ability to perceive pain and handle pain was a lot better. Blood pressure management was also done with the help of some animal interventions. They also had a lot of diagnostic roles, like many animals are trained, dogs especially are trained to detect blood sugar levels and to detect markers for certain forms of cancer. And they can also alert if there is a seizure alert, or if you call this as epilepsy or fits. So if there's going to be an episode, dogs were capable or trained to alert the patient or the caretakers. And of course, animals have always been used for trauma, post-traumatic stress disorder, dementia. They have been introduced to as companion animals for cancer patients. For mobility issues and neurological processes like multiple sclerosis, stroke, spinal cord injuries, animals have been used, and the fact that you can use them to facilitate mobility has also been studied. And of course, in the Western countries, there are concepts of retirement homes, and you have hospice centers. Hospice centers are basically places where say patients are admitted for leading the end days of their lives. So animals are very frequently incorporated in these facilities. Animals in pediatric therapy is still very recent. It has happened only in the last few I would say years. There are three major categories there. You have service animals, you have companion animals, and you have therapy animals. Now, service animals are basically, they are trained for a very specific purpose. They undergo very rigorous, high-end, task-oriented training, and you can't generalize them as pets. So they can't be a pet for the whole family. But if the service animal is in the family for long enough, of course, that can always happen. But primarily, they are trained for particular purposes. So they are trained as mobility companions. Of course, the most common service animals are service dogs, but some miniature horses, some variants of monkeys have also been used as service animals. And the American Disability Association actually has given permission for these animals. So service animals are used as mobility companions. They are used as guide animals, especially for blind children. They are used as hearing animals, where they are taught a few communication cues, especially if the child has hearing impairment. And then psychiatric animals, they are the animals who accompany children who have extreme anxiety. Autism animals is a different category, but dogs are extensively used to accompany children with autism. And then, of course, many dogs are trained for medical emergencies. Seizure sensing dogs, just like in adults, we have seizure sensing dogs for children. We have monkeys that are trained for some fine motor skills if a child has impairments in all the four limbs. And many miniature horses are used to help the child in mobility. Now, companion animals are basically the next category after service animals. You have the companion animals. They are basically pets. Pets are animals whom we have allowed to share our habitat. When I say habitat, I mean our homes. They give us company. And usually there is always a criteria on how we choose pets. And a lot of us might be different, but predominantly people choose attractive animals. We choose animals that are intelligent. We choose animals that are relatable. And sometimes it's altruistic. When I say altruistic, it means if I have rescued an animal, I would probably adopt that animal. So that's how we end up choosing pets. Now, of course, the most common ones are dogs and cats. And if people have farms and large area, some of them do adopt and keep horses as pets. But a lot of unknown animals, like in the Western countries especially, you have children who have rabbits as pets, and pigs and rodents and ferrets and hamsters. You have birds, and you have reptiles, like a lot of people have turtles as pets. You have fishes, aquatic animals. Now, I'm going to focus a lot on these three categories of animals. So why dogs, why horses, why cats? Of course, dogs, because they were domesticated so early, they have adapted to us very fast, and their brain, the way their cortex works, their cerebral cortex works, is they are able to adapt and learn very quickly. So that is one of the reasons dogs form such an amazing companions for us. They're extremely social. They interact very well with you. They are outgoing. They are friendly. They understand how we talk. They understand our tones. They understand whether we are angry at them. They understand if we are praising them. They give you excellent eye contact. Of all the mammals, dogs are not only capable of giving you good eye contact, they're also capable of maintaining good eye contact throughout your interaction. So I think, and that's a very relatable aspect for us. Dogs are able to distinguish between who is friendly and who is not. Dogs are able to play with us. And genetically, in terms of our social needs, dogs are very similar to us. Of course, we discussed the limbic brain aspect before. So limbic brain is also one of the aspects, and also they have better cerebral cortex. So you can train them to learn new things. And that is one of the reasons they form excellent companions. Now, horses actually were originally bred to be rode upon. Like we used to ride horses, and to be able to be a very good rider, you had to communicate to the horse very well with your body language, and that has sort of enhanced the way horses understand our body language, and they are very intuitive, and they're extremely sensitive animals. Um, if you are able to just look at this small diagram I have behind me, this is the human brain actually. But this particular portion that we have, which is very small for us, it is the cerebellum. It's here. Horses have a very large cerebellum. So they are able to perceive stimulus from their environment at a faster rate, and they're able to process it very well. And they're extremely quick with their reactions, and they're very intuitive. So that is one of the reasons horses ended up becoming such an important companion for humans. Like I said, highly evolved, a cerebellum, and good at understanding body language. And also whatever they learn, they retain the information for life. So, and that becomes very important if they are going to be your companions for a very long time. Now, cats, of course, cats practically domesticated themselves. And nobody chose them. I think they realized that being close to humans meant that they will always have access to rodents, which will come wherever we store our grains, and that's actually how they started getting domesticated. And cats are extremely skilled at adapting new behavior. They will communicate to you very nicely. They can change their facial expressions if they want food, if they want to be let out, and they have excellent sensory motor development also. And this ability to communicate with humans, and of course because they're so cute, they are able to be a very good companion, and also because they're small, sometimes they are less intimidating than perhaps a dog is. Some animals, some cats, you can actually train them. Cats are extremely instinctive, so training is not as effective as with dogs, but many cats have been known to be trained for small things. Of course, the other small animals that we discussed about, they are purely if you're just looking for a comfort animal, or you're looking for an animal you don't have to maintain much, which are less scary, who are harmless. And if you live in an apartment where you can't afford to have a dog, or if you can't afford to have a cat, so you can have a small animal. They're just less demanding also. Now, of course, introducing a pet in a household is a huge responsibility. So parents have to know that it can never, no matter at what age you introduce a pet in your house, it can never be a child's lone responsibility. Parents have to be very actively involved. There needs to be an open discussion about what is going to happen once a pet comes into the house, especially if the child is older. And even if the child is younger, and since a lot of Indian families have grandparents living together, everybody needs to be on the same page if the pet comes to your house. There needs to be a lot of planning. A pet is like another baby, so if you bring a pet in the household, the pet needs to have its own space. You need to take care of the food needs. Your budget will go up, because taking care of an animal can be a little financially straining also. So you have to keep all of that in mind. And a pet is going to be with you till the end of his life. That is the ideal situation. I wish all pet owners accept that. You cannot abandon the pet when it's too difficult for you. So keeping all that in mind, you nearly need to plan, and it can never be an instant decision, a decision that you just take out of impulsivity. Once a pet comes home, it is very important that you start involving the child in all the aspects of pet care, right from feeding to taking care. Let the child participate. Even if he doesn't do the whole task, he can start participating. So that way, the child becomes a part of the pet's routine. And the whole purpose of introducing or having an animal for your child was that, so that you can improve the child's involvement in the animal's life. Then of course you have to monitor, especially if the child is very young or the pet is too large. It's very important that you monitor their interactions. Overall, also, if you have an adolescent, if you have teenage children in the house and they are doing a lot of pet care, you still have to oversee that everything is done correctly. And of course, by your interaction with the animal, you have to set an example for the child. Now, what does having a pet do for the child? And this is all research proven. A lot of children have been interviewed and observed for their inputs on what their life is like. So many children see pets as a safe space. They can talk to their pets, they can share their secrets, they can share their private thoughts, and they form a very close bond because of this activity. And because they are incorporated in their daily routine, pets are a responsibility for the child. So the child learns the whole concept of what it is to be responsible for another living being. And of course, because it's an animal, there is an innate connection to the nature, and you learn to respect other living beings. Of course, having a pet makes it a point that, especially if you have a dog in the house, or if you have a horse in your farm, or if you have a cat also, you have to engage them, you have to play with them. So there is a natural increase in physical activity. There's a lot of handling, so there is a lot of comfort that the child gains from being close to the pet. And of course, you learn what it is to be loved without words, and you understand what it is to be loyal to someone, and the natural affection that these animals bring to your life. And also, children understand the complex concepts of attachment. They probably don't understand it like theory, but they understand the action part of it. Now, specifically for dogs, there are general do's and don'ts. Some of them I have already discussed, so I'll be just running through them. A lot of do's. First of all, the most important do is that never leave your dog untrained. It's very important that once you get the dog home, start training the dog, because that way you will be in control of the situation. You can actually stop the interaction between your child and the dog whenever it is required. And also, if the dog can respond to a few basic obedience commands, it can bring about a lot of change. It can enrich the child's response with the dog also. You have to supervise their interaction, especially in the first few days of the dog's life, especially when the dog is a pup, and or if the dog is very large and the baby is new in the house. You know, you have to always supervise their interactions. You have to set boundaries. So maybe the dog has a sleeping area, eating area, the child has a sleeping area again. So try to make sure that the dog knows he's not supposed to come here. So a few basic boundaries will always keep these interactions very comfortable. Try to do a lot of bonding activities where you are the facilitator and the dog and the child, they try to interact with each other through you and the activities that you put together. It is a preference, and it's been supported by evidence, that if you're going to be a first time dog owner, it's good to get a dog as a puppy, because puppies will bond better with your child. There is no problem with older dogs, you just have to be more careful on what dog you're choosing and make sure that the dog is trained. If available, look for friendly breeds. I'm not into breeding, but there are a lot of ethical breeders who breed in a very humane way. And if you have access to information of who breeds dogs, like say maybe a Labrador or a Golden Retriever, who are generally seen as friendly animals, gentle animals, so you can look for friendly breeds if that's a requirement. Of course, it is so important that the dog is a child in your house now, so you have to keep the dog happy, stimulated, and also respect its space, and never impose yourself or the child on the dog, especially if you are getting the message that the dog is not interested. And of course, there are some don'ts. You should not leave the child and the animal alone, especially in the initial days. Please do not abuse the animal, no screaming, no hitting, because whatever you do, your child is watching, observing, and that becomes a part of their interaction with the dog later on in life. And if there are any stress signs in the dog, make sure you talk to the veterinarian and get them in the fold. Try to understand what to look for, and treat the dog just like another child in the house. Now, of course, what does research have to say about? So these are basically all the studies that I went through where proper formatted studies have been done. It's been known that it's been found that having pets teaches your child to be very patient, very kind, very empathetic, and these qualities follow the child all the way till the adulthood. It improves the child's self-esteem and loneliness. It also has a lot of cognitive benefits. The child learns to observe, the child learns to imitate, the child learns to tolerate, and the child also learns to associate different things. So that can actually help them cognitively. There is a lot of behavior development, especially for older children. They learn responsibility, they learn how to share, they learn how to be social, and they also understand the importance of setting a routine, because a dog will have a toilet routine, a feeding routine, a sleeping routine. So, you know, a growing child will also understand the importance of that. Of course, they understand concepts like affection. And it's been found that, especially in single child households, having a dog just gives them a slightly better level of family satisfaction. If you don't have a sibling, the dog sort of fills in the gap. Also, some health related benefits is that early life dog ownership, it's been proven that mild developmental delays, the risk of it has been reduced, because a child spends a lot of time on the floor exposed to the dog. So there is a lot of motor abilities that is developing. Similarly, there was a study done where they found that having a pet in the house also influences the screen time. And if you're able to create bonding activities with the dog instead, the child will not really ask for the screen as much, especially in today's age. This was an excellent study that I found, which proved that early exposure to pets, it modulates your immunologic response. So your tendency to develop allergies later on as a teenager or as an adult is very less, because your immunologic responses are modulated. Of course, there are a lot of mixed opinions, but there was this one study which found a very favorable result. And of course, if there is an obese child in the house, this can be a very good motivation for physical activity. Of course, general advice is always talk to your veterinarian. If the child already has any allergies, you have to be careful. And you have to slowly desensitize the child to the concept of the animal, especially if there is a innate fear. If the child is naturally fearful, then you will have to do a step-by-step desensitization before you suddenly bring a pet in the house. Of course, it's not just you, it's also your family. So make sure the family and the house is well prepped for the animal. You maintain general hygiene. You can't expect an animal to behave. So you have to take care of the hygiene aspect, safety and security of the animal, and of course, dietary preferences and physical stimulation. Now, that is an entire section on pets. Now we move to animal-assisted interventions. Animal-assisted interventions are basically programmed activities which are done by therapists who are trained in using the animal for a particular purpose. And they're very focused, they're very purposeful, but in a way that the child can warm up to the idea of an activity. So the necessities are that it needs a certified therapist, it needs a trained animal handler. The therapist can also be a handler if the therapist is comfortable enough. They need to have fixed therapeutic goals. And also always remember that animal assisted interventions are to bring about mild changes in the child. They cannot be the sole therapy. They will always be added with other forms of therapy that the child is going through. So in animal assisted interventions, two of the extensively studied interventions are therapy dogs and horses. So these are the two things that I'll be covering today. Of course, with therapy dogs, with the breeds that are usually selected as therapy dogs are friendly breeds like golden retrievers. This one in the picture is a poodle. Saint Bernards are those large dogs, if you don't know, and Labradors. Smaller dogs like poodles and Pomeranians help, especially if the area in which the therapist is going to work is small. And these dogs are usually very well raised, they're well trained. And it's always appreciated if the therapy dogs are of an even temperament and they're able to handle sudden changes in the environment, because a child can be unpredictable. And you have to stimulus test the dog. The dog has to understand that a sudden scream from the child is not harmful to the dog. So the dog should know to be calm. Of course, that's a part of the dog's training. And it should always be pleasurable to the dog. It should not be stressful to the dog, because only if the dog feels good about participating in therapy that he can bring about positive changes in the child. If the dog overreacts when the child is crying, then the whole purpose of introducing the therapy was lost. So it's always important that you also look for stress cues in your therapy dog. Now, traditionally, it's practiced extensively in the US and in Europe. So the interventions that are usually done is sometimes just being in the same room, like you see the therapist is interacting with the baby here. The dog is just there. But I feel the whole idea of this intervention was to keep the child in good spirits so that he participates well with his therapist. Petting and cuddling just to improve the way they are in a room, that can sometimes be a prolonged part of the therapy session. Walking a dog, teaching a dog a new trick. Sometimes when you teach a dog a new trick, right, it gives you an immense sense of achievement, and that can be extremely in sort of, I think, rewarding for a child who has issues. Outdoor play with the dog, where you can incorporate many gross motor challenges and try to incorporate the play with the dog and try to elicit responses from the child. Grooming the dog can be an activity that can be done. Drawing a dog or describing a dog, reading to a dog, it's one of the very commonly done interventions. So what research do we have in terms of therapy dogs? It's been proven that therapy dogs increase your oxytocin levels, they decrease your heart rate, they decrease your anxiety, they decrease your blood pressure. They reduce all the stress signs that children usually undergo. They have seen that there were studies done where a therapy dog in a classroom always made the act of learning a very pleasurable experience for the children. Children look forward to going to the class when they know that the dog is waiting. Pervasive developmental disorder was an older classification. Here they found that children were more playful, they were more focused, and they were very aware when the animal is in the room. Therapy dogs have been used in pain clinics, especially in cancer clinics where children are actually experiencing a lot of pain. So having an animal in the room reduces their pain perception. Therapy dogs have also been used in outpatient training centers for children who are extremely obese. I found this interesting study where they found that children who have stammering issues or children who have difficulty in reading out aloud, they used dogs in interventions and noticed a phenomenal change in the way the child reads. So this was an academic study that was done. And of course, having a therapy dog accessible in a hospitalized center will just improve the mood in the children. Using dogs in autistic children is an extensively studied phenomenon, and like they are used to make the child understand road safety rules. They are used to play simple games, to teach the child the concept of friend, best friend, companion. Of course, having the dog in the child's life also reduces parental stress, because it's already very stressful to raise a child who has issues, adapting to the world. Dogs are also, they make the child more tolerant to enjoying newer experiences in life. They are extremely good sensory supports. They're good with speech development and autism. And there was a study, this is an extensive study done in the University of Lincoln 2 years back, where they tested effect of dogs on hundreds of autistic children, and they found that there were so many plus points to having an animal in the child's life. This is just something that I found, and I thought it was very important to share, that most dogs enjoy being part of the therapy session, and that is why they are able to deliver and they are able to bring about a change. So certified trainers, they look for enthusiastic dogs and not just tolerant dogs, and it has to be mutually beneficial, so that when they look forward to the session, they will actually be able to perform better also in a session. The next category of studies actually is equine assisted therapy. There you have therapeutic riding, where the child is exposed to the horse and they go on slow rides. There is hippotherapy, which is specifically done to enhance a child's motor abilities. There is adaptive riding. Basically, if the child has any difficulty or any structural issues, they make adaptive gear and make horse riding pleasurable for the child. There is equine assisted learning. A lot of psychotherapy modules are done on horses. And the benefit from horses is because they are so sensitive. It's an excellent sensory feedback for the child. There is very good muscular and skeletal benefits that the child gains. And because the child is experiencing movement and visual feedback, it can be a very good vestibular and ocular feedback. And of course, it offers very good psychological, social, and educational benefits. The kind of activities that are usually done with the horses are, say, a very simple activity like walking a horse can make a lot of difference. Grooming a horse, where they brush the horse, they take care of the horse, the horse's gear. Then slow riding, sitting on the horse and doing some activities like you can see in this picture, how the child is reaching out, and riding with the therapist. And also, if the child has special needs, there will be some adaptation. Now, hippotherapy or equine assisted therapy has been extensively researched, and it's been known to reduce irritability and hyperactivity in autism. It improves social and communication skills. There was a study that I found where the number of words that the child speaks, or the number of existing words that the child uses, seems to have increased after a few sessions of equine assisted therapy. If the child has ADHD, there are a lot of improvements in ADHD in terms of their attention, their impulsivity. Communication skills in Down syndrome seems to have been improved. Then, of course, cerebral palsy, we all know, because there is a muscular imbalance here. Doing a few sessions of hippotherapy has known to increase muscle symmetry, how the child maintains his posture, the balance. And the cerebral palsy children who start walking, it improves their walking speed, again, works on their step length and their pelvis. There were so many studies I found on association between speech and language therapy and equine assisted. They said that there is good motivation, good participation, good arousal, attention. So the child actually picks up words faster. There is improved swallowing, there is increased breathing mechanics, and all of these are studies that were done and with proper outcome measures. Now, some of the lesser known animals that studies were done, like for instance, cats were known to be very good if the child has mild to moderate ASD. In this particular study, they were able to identify that certain breeds like the ragdolls or the Maine Coon cats, they're supposed to be very human friendly, and neutered males are supposed to be good companions. So you can understand how, if it was just a cat, now this particular study tells us that, okay, you can probably look for a breed, or you can probably look for a neutered male. And also, it's good if the cat is adopted as a kitten. So it was found that these cats were more affectionate with the children. Of course, there was a study I found about fishes in an aquarium. From that study, it was found that they had a calming effect on children with ASD, and they preferred large tanks instead of small bowls, fish bowls. And they prescribed that you put a different group of fishes, and the fact that the fishes move and you install a feeding routine incorporates a better change in the child. There were some studies on guinea pigs. I don't think we have a lot of guinea pigs in India. I don't think it's a concept. I have seen a few of them, but guinea pigs are also known to influence positive behavior. It is just in the small animal category. There were some studies where rabbits were kept in the classroom and they found good motivation. And of course, farm animals were also incorporated. Of course, this is basically how animals are introduced as a whole, but animals can always be introduced in the child's life in the form of pictures, imagery. You can put up posters, you can bring toys with animals as figurines, and start introducing initially and then slowly probably introduce the whole animal in the child's life. If you cannot have a pet at home, make sure you are able to incorporate taking your child to a farm or a zoo or a friendly shelter or a rescue home, so that the child gets to see and experience what it is to interact with an animal. Desensitization, of course, there are steps in which you can slowly introduce the animal. So never abruptly bring, especially if there is an existent fear. Always try to foster first, keep the animal for a few days to take care and see if it really works, and then probably adopt, because it will give you a better idea of whether it's a good fit for your household. I'm almost done. I'm sure it was a very long talk. I just wanted you to introduce you to Miss Regula Fair. She's an animal therapist from Switzerland. She was one of our resource persons in last year's workshop that I did. And this here is her dog Molly. She works with Molly as her companion therapy dog, and she was kind enough. She was kind enough to share a small snippet of her therapy session with me.
Hello, I'm
Sorry. Yeah. So in closing, I would just like to say that the idea of this talk, of this very long talk, was to create awareness that animals can be very enriching, very therapeutic in your child's life. And also the fact that their presence should be mutually pleasurable. It's a very creative form of sort of introducing therapy in your child's life. It's non-exploitative. That is one of the key things. We are not abusing the animal to perform for us. We are trying to make it mutually enriching for the animal and for the child. Thank you.
Yeah. So, Priya, thank you very much for that very nice, elaborate session. So, I think you've covered almost every aspect. I think it's a mini, what to say, kind of a big.
No, I started putting together the talk and I didn't know what to include, what not to include, because I knew that there were parents, there were professionals. So I wanted to kind of have a mix of everything.
Yeah, but it was well done. It was well done and was very well reached. Yeah. And so we have one question. Okay. So it's from Prachi. Okay. So her question is like, how do you know that whether your pet or especially the dog, what she has, okay, can be a therapy dog, and where to get it assessed or how to do it, go about it?
From my knowledge, there are behavior trainers available in many of the major cities now. So behavior trainers are able to do something called as temperament testing for your dog. Basically, they are able to do temperament testing and stimulus testing. And if the dog does not have those skills, we would first work on those skills, start adapting the dog to a lot of these temperament changes that they can experience if they are in a clinical setup, and stimulus testing, and then you have to start using them in therapy. So you will have to contact a veterinarian or a dog behavior trainer especially, who are able to understand how the dog can be morphed and the dog can be trained to become a good therapy companion for you, especially if you are a practitioner.
Okay, good. Thank you very much for that. And there is another question from Ms. Ekta. Okay, so her question is, how do we remove fear from the dogs?
The dog's fear or the child's fear to the dogs?
No, sorry. How do we remove our fear for the dogs? If
Okay.
somebody has phobia towards dogs, no? So how do we remove it? Yeah.
So I did mention a small thing which I did not elaborate because the presentation was already going too long.
Okay.
It's called slow desensitization. Basically, when you know that the aspect of being with a dog can be very scary, I would say exposure should be done very step by step. I would perhaps visit a shelter and have a distant interaction with the dogs, where you're just doing something harmless like feeding the dog, or just doing a very simple fetch with the dog, or where you're not really interacting. Maybe the dog is in a different enclosure and you are in a different enclosure, and you're just interacting the dog based on positive experiences. So once you start doing that and the dog starts reciprocating, right, slowly it's not just a cortical response. Your emotional responses to the fact that you made the dog happy, or you could elicit a playful response from the dog, can actually help you lower your fears towards approaching. So it's not an overnight thing. You can't bring a dog in the house and expect that, okay, my fear is going to go away. You have to expose yourself in different ways. Go visit shelters, go visit friends and who have dogs, go visit their homes and start interacting with them in a way that makes you comfortable. I'm sure fears are always there must be some childhood incident, or I think some kids are just, some people are just generally afraid. So you have to start doing a very slow exposure, and then slowly interact with them a little more and more. And over a period of time, the fear definitely comes down.
So choosing a different, different kinds of breeds, or a different, apart from dogs, for example, if they choose cats or something, is something what is generally recommended, or we can go away straight away with any other pets?
Since she particularly asked about dogs, I was telling about dogs. See, dogs are a little intimidating because of the way they approach you. But if you have a fear that is just not going, then of course, choosing harmless smaller animals like rabbits, hamsters, or you can use a smaller kitten. You can start there, and then probably desensitize yourself to the idea of having pets, and then move on to dogs if that's really required. But if you are not comfortable around an animal, there is no point in introducing that animal to your child, because you are not going to be a very good facilitator there. So your fears will be very obvious, and the child will actually feed on the fact that even mama is scared or papa is scared, so I should also be scared. So bring a dog home only if you are comfortable. That's very important.
Yeah. So thank you. I hope that answered your question, Ms. Ekta. Okay. And there is one more question. So it's again from Prachi. Okay, she's asking, like, is there any service dogs available in India?
I have heard of a center in Chennai that trains some service dogs, but the really advanced service dogs training happens in the US and Europe actually, because their certified courses are available and very high-end rigorous training is done. So there aren't that many centers in India, but I am aware of a center in Chennai. If she needs like contact details, I will just need a day to find it out for you.
Sure. We can pass it on. Okay, good. So any other questions, participants?
I just had a small thing to add. In my research, I did not find a single study that was done in India.
Okay.
And that itself tells you that either there is no awareness, or there are not enough practitioners, or maybe there are very few practitioners, or the whole idea of the fact that you can incorporate an animal in a positive way in therapies, and it's never been studied. So that itself tells you that there's a huge lacune, unexplored thing. So we would need to work on improving the availability of practitioners.
Sure. That's rightly put up. Okay. Good. So if there are no other questions, so we'll wind up for the day. Just a minute, I'll just check the chat box if anybody has anything to say. Good. So all good feedbacks and comments. So thank you participants for joining us, and thanks again Priya for the wonderful talk.
Thank you.
Okay, there is just one question which has just popped up. If you're okay, we can take that up. Yeah, just 1 minute. So, okay, so this can be a little tricky question. Okay, so it's from Miss Rohini. Okay, so we are so busy looking after the child whom we need to take care for different sessions, practice them at home. Won't the pets be a distraction if they are around all the time?
Of course, it matters at what stage of intervention your child is. If the child is just starting with therapies, and then maybe getting a dog and distracting the child might not be the best option. But at the same time, having a pet in the house need not be a distraction. In fact, it can be a very positive influence on your child's mental abilities. The child will feel motivated to be more social. The child might feel more motivated to be more interactive with you, and that can actually help you in all your efforts to bring about changes in your child's life. So you have to weigh it with all the specialists whom you're working with. But if the child is at very early stages of therapy, maybe not a very good idea. But I'm not saying that you can't do it. You just have to do it under proper guidance. That's all.
Priya ma'am,
Yeah.
how would you know Maurya, right? Do you think
Yeah.
like, at what age would he be capable to handle a pet?
Maybe a year more, given he has just learned to become a little more stable motor-wise, and you are still working on his sensory skills and all that, and his communication. So if it gets a little more comfortable for you to handle him, then maybe getting a pet home is a good idea. But it also depends on you, Rohini. If you are comfortable with an animal, then you can actually facilitate very good interaction. And some of the pet owners I know amongst my patient circles are parents with extremely severe autistic children in their homes, and I have seen them use the dogs very beautifully in their interactions, and they find that the child is a lot at peace, reduced hyperactivity and all that. So it's really upon your comfort zone. If you are comfortable, you can actually facilitate great interactions, and it is not a distraction unless you allow a completely unsupervised interaction all the time. So
Okay.
if you are not comfortable, maybe a year more, but if you are okay, maybe after a few months you can attempt. And I would advise you first take him for sessions or have him interact with dogs in other homes and see what body language he presents, and then probably think of getting a dog home.
Yeah, he actually likes them, so let's see.
Maybe you should.
Yeah. Thank you.
We can always trial out new things with the kids. Okay, good. So thanks
true.
again. So thanks, Priya. I think thanks to the participants again for your support again. And hopefully we will meet again next week for another very nice sessions soon. Okay. So thanks again, Priya. And thank you. Bye-bye. Take care.
Yeah. Bye.
Thank you, ma'am, sir.
Thank you.